Good afternoon, and welcome to today's webinar titled Privacy of Protected Health Information in the Cloud, Risks and Rewards. My name is Jeanette Wider, and I'm Managing Editor of Healthcare Innovation. Today's program is sponsored by Dell Technologies. Thank you to our sponsor and to our audience for giving us your time and attention today. Before we get started, we have a few housekeeping slides. To submit a question, please use the Q&A box to the left of your video window at any time. You do not have to wait until the end of the program. For technical issues, please press F5 to refresh. And if that doesn't work, you can submit a question with your issue through the Q&A panel. Finally, join our webinar conversation on Twitter. You can tweet using the hashtag HILiveWebinar. At this time, I'd like to introduce our speakers for today's program. James Engel, Ph.D., Product Manager, IT Services Security at Trinity Health, and Aaron Logue-Smith, Cyber and Compliance Practice, Global Technology Office, Dell Technologies. Thank you, Dr. Engel. I'm now going to pass this off to Erin Logue-Smith. Erin, why don't you introduce yourself?
Sure. Hi, everyone. It's great that you're here today. My name is Erin Logue-Smith, and I am with the Cyber and Compliance Practice Group in the Global Technology Office at Dell Technologies. I am a lawyer by trade. I've been working in data privacy and security for about 10 years now. My main focus used to be on international privacy and healthcare privacy, but as our world has changed, my focus has really become more around cyber resiliency and protecting data against ransomware. Did you want me to go ahead and start with my presentation?
Yes, please.
Okay. Is everyone able to see my my slides? Okay, perfect. All right, so moving along. Sorry, everyone, I can't exactly see what you guys are seeing, so I'm just trying to navigate here. So we're going to change the topic just a little bit from only privacy to really encompass, what's really at the forefront of everyone's minds today. Since the pandemic started, and even before that, the trend was ticking upwards for, ransomware to start coming into the mix. It was something, newer to everybody, and cyber attacks, really were not as prevalent, before the pandemic as they are now. So what we have up here on the screen right now is just a little blurb on the state of cybercrime today, and it's only getting worse as time progresses. So what we see up here on the screen now, we did talk about HIPAA, and we did talk about the NIST cybersecurity framework. Again, this is a privacy conversation, but you can't talk about HIPAA without talking about security as well. So there are a few, legal standards in the cybersecurity area. Organizations really have been looking for frameworks such as NIST to help supply those best practices and to understand how to best protect an organization from, technically and risk management standpoints. So as I said, NIST is really what we use here at Dell Technologies, and HIPAA really does go hand in hand with NIST. So the HIPAA security rule itself requires the implementation of security measures to really help prevent the introduction of malware and ransomware itself. So it is in their standard. They don't really address it too deeply. So we have to rely on other regulatory bodies to give us some guidance around this. So what are the experts saying? What we've up here on the screen. There is no federal regulation for cybersecurity. Really, the healthcare, HIPAA institution with privacy and security has been a leading focus for healthcare for a long time. They stepped into this ballpark way before everybody else, way before GDPR came out, before California implemented their privacy rule. The HIPAA privacy and security rule really was the precedent. But what we're seeing now with these ransomware attacks, there's a different type of, perspective. So what are all these regulatory bodies suggesting? Protecting a copy of critical data offline in an isolated manner, it's really the best way to provide recovery from a cyber attack. So when we're talking about patient data, when we're talking about privacy, we really need to be mindful that you can't protect yourself, you can't keep your privacy, you can't meet the HIPAA privacy rule requirements if your data is vulnerable. So continuing on that path, really, like I said, my focus was, international privacy and healthcare privacy for a very long time, but there really has been a paradigm shift in what we're seeing out there in the wild today. So at the end of 2020, the most notable thing that I've seen in my career in a long time, the U.S. Department of Homeland Security, in conjunction with CISA, published a ransomware guide for best practices for directly addressing the ransomware increasing cyber threat landscape. So we're going to look at that. The guidance in here states that organizations should regularly back up gold copy images of their data. They should use an air gap and password protect copies offline. Also, they suggest the implementation of a recovery plan to maintain and retain multiple copies of sensitive or proprietary data in servers in a physically separate, secure, and isolated location. This is the first time that we saw anything from the government, putting out a recommendation on how to best, recover from a cyber attack. And since then, things have really just kind of gotten worse. What we see up here now, we had an FBI alert. I think you guys are all here because you are aware of that. But at the end of 2020, a joint alert was issued the end of October for the healthcare industry from the FBI in conjunction with the HHS, which is the governing body for HIPAA, after they received credible information of an increase in imminent cybercrime threat to U.S. hospitals and healthcare providers. Federal agencies warn that cyber criminals are unleashing a wave of data scrambling extortion attempts against U.S. healthcare systems, and the attempts are designed to lock up hospital system information systems. So I actually saw a couple of our customers succumb to devastating cyber events where they had to go back and actually use paper records for over 2 weeks with no access to their digital systems, which I think we all know can cause absolute chaos and can potentially put patient health at risk. So again, this alert points to the Ransomware Best Practices Guide to regularly back up gold copy images, have an air gap in place, password protect those copies offline. Just reiterating that. So what I have up here right now, it's just a little, healthcare industry is a target. These are some of the challenges, some of the solutions, and some of the results. So as I said, I do work for Dell Technologies, and we have been working very hard to develop a solution called cyber recovery to protect your data as a backup whenever you do succumb to a devastating cyber event. So I did just pop this up here for a little information for everyone up that has joined today. I'm not going to dive too deeply into this because I know we are short on time. So moving right along, as we had talked about earlier, I want to just bring back up the idea of the NIST cybersecurity framework. So to help provide context around where cyber recovery here at the solution that we offer here at Dell Technologies fits into an overall and essential privacy and security resiliency plan within a hospital type of situation, we like to start with a standard definition of what resiliency really does mean and break that down. So resiliency means the ability to prepare for and adapt to changing conditions and to withstand and recover rapidly from disruptions such as deliberate attacks, accidents, or naturally occurring threats or incidents. Cyber resiliency is a strategy that incorporates people, processes, and technology into a basic holistic framework that protects an entire organization. Meanwhile, cyber recovery, the solution that we're talking about right now, is a component of an overall cyber resiliency strategy. So cyber recovery distinguishes itself from traditional backup and disaster recovery in several ways. Cyber recovery provides additional layers of physical and logical security at both the solution, system, and data file level to ensure that critical data such as PHI can be preserved with integrity, confidentiality, and to ensure it is available when it is needed for recovery if the hospital information systems should succumb to a devastating cyber event. So cyber recovery really is focused on protecting critical data from cyber threats away from the attack surface. And then it is there to enable recovery of that data from an isolated environment when and if it is necessary. Okay, so over the past 6 years of working on the development of this solution and deploying to over 950 customers across the globe, Dell has discovered that there are 3 main advantages that are most important to having a cyber recovery solution to protect your very important data, such as patient information. So number 1 is isolation. we need to see a physical and logical separation of the cyber recovery vault from the attack surface of production and backup infrastructure. We do build vaults physically, but we also have them in the cloud. So it's very important. Anytime your customer information is put into a system, it becomes vulnerable. So we really do need to protect it, because if it's in the system, someone was going to have access to it, and if a devastating cyber event occurs and there's a breach, that is going to be bad for everyone. So number 2 is immutability. Although the market disagrees on the standard definition of immutability, here at Dell, we define immutability as the hardware and/or software, in addition to the controls that ensure the original integrity, confidentiality, and availability of that data should, in the vault, is preserved. Okay, so number 3 is intelligence. So something that we do here at Dell Technologies is we like to use AI and machine learning within the vault to review all of the data that's in there and make sure that there is no anomalies, meaning that there is no one lurking, doing a ransomware hack that no one can really see on the surface, but under the covers. So we use intelligence by applying innovative and comprehensive tools and analytics, machine learning with AI within that security of the vault to identify potential cyber threats or corruption, and to help to ensure the vaulted data is recoverable when and if it is necessary. So the significance is that these 3 components are working independently and collectively within the integrated solution to provide the maximum levels of security and protection for vaulted data, which really gives your organization the best possible chance to recover your gold copy, mission-critical patient data with integrity and confidence should an attack penetrate your data center. Okay, so what we have up here now, I like to call this the lifeboat slide. I like to pop it up here because we're all thinking about our mission critical data and things that we might need to see in the vault. And it's nice to just, we don't really think about our data, but data privacy and security is the most important thing that we need to protect when it comes to these types of situations. So I do pop this up here just to get everybody thinking about what you would consider to be your mission critical data and what you would want to see put into the vault. So that really is it. I can turn this back over to the presenters. I think we have some questions coming up, but if anyone would like to learn more about this, I'm more than happy to join a deeper conversation and to provide some links and things like that. But to the admin team, that is the conclusion from me.
Thank you, Dr. Engel and Erin Loeb-Smith, for a very informative presentation. We've received a few questions, but we are running a little close on time. So we have time for about one. And one of our audience members asked, where do I begin? How can I determine what my current level of cyber resiliency is? Erin?
So we do have an accessible cyber assessment tool that you could go to on Dell Technologies page, or we can pop the link in to provide to everyone. I'm not sure how to do that, but we have a predisposed, I'm missing the word I want to use here, but we have a cyber assessment here at Dell Technologies that can really help you. It's a question and answer type of thing that you can go online and just pop some questions in, answer what we have, and it'll give you an assessment of what your cyber resiliency state is today, and then recommendations on how to bring yourself up to speed and what Dell Technologies might be able to offer to help ensure that you guys will be able to recover if a devastating cyber event were to harm you.
Great, thank you so much. Unfortunately, that's all the time that we have for today. I would like to thank Dr. Engel and Erin Loeb-Smith for an excellent webinar. I would also like to thank our sponsor, Dell Technologies, for making today's program possible. Finally, I want to thank everyone in our audience for joining us. We hope you'll join us in the future for another healthcare innovation webinar. This concludes today's presentation.
Thanks, everyone.